Hey, once again, ladies and gentlemen, let's welcome Miss Chia. Once again, welcome, welcome, and welcome.
So for today, I'll be talking about common eye disorders in children, 常见儿童眼睛问题. So that's translated in Mandarin to suit the local crowd. So my name is Chia. A bit of information about myself. I graduated from University Kebangsaan Malaysia many years ago. I'm actually from the same school as Marcus, so I'm his senior by 2 years. So I also did my master's in UKM many years ago. So I've lectured in UCSI and Sagi University. I've also done training for Bosch and Lomb, Bolton Optical Group, and now I'm with Focus Point as their professional services manager and head of training and development. So apart from that, I also have volunteered in the Association of Malaysian Optometrists as their secretary, executive committee member, and also newsletter editor. And lastly, I've also done a few chairing their seminars for them. So before we start, let's look at some demographic and some background on this topic. So if we actually look here, we have a study from India. So this study from India is from southern India. So they study actually 15-year-old and younger, and they found that in these children, 11,206 children, which is aged between 4 to 11 years old. They generally have refractive error, eye alignment problems, strabismus, lid problems, lens problems, corneal scar, and globe abnormalities. They also have something what we call like the pitot spots, which is a vitamin A deficiency. So this is very common in India, but very uncommon in Malaysia because Malaysians are generally very well fed. Okay, so in Ethiopia, in Africa, what we also have is another study in eye clinic. So they actually did it on 1,237 children between born and about 8 years old. So most of them are male, and they have strabismus, eye motility disorder, which is eye misalignments. They also have childhood cataract, infection, tumors, and also congenital abnormalities, some misformation from birth. So the most common form of eye misalignment is convergent strabismus. So what convergent strabismus is inward misalignment of the eye. So the eye twists inwards towards the nose. And in Malaysia, this is by Chu et al. At a preschool. So these children are about 4 to 6 years old. And they found that these children generally have refractive error, meaning maybe long-sighted, short-sighted, or astigmatism. They have nasolacrimal duct obstruction, meaning the pathway within here that is to bring the tears out of the eye is obstructed or blocked. They also have allergies, some form of exotropia or esotropia, some form of eye misalignments. So in the refractive error category, they have astigmatism, 84% of them, and they have myopia, 9% of them. So that's in Malaysia. So what's normal? What's 正常眼睛? So normal will be we are born with very poor vision, about 260. So at birth, we cannot control our eyes very well, especially eye movement and fixation. So and also at about 6 months old, we have 6/12 vision. At this point, we can discriminate color. We can see the difference between red and green. We can also see facial features and see further away, like 120 to 180 cm. And also, we will start fixing at faces, like your mother's faces by 6 weeks old. And we will start to follow large, bright objects by 8 weeks old. So this is at about 40 cm distance. So if your child, you realize that they are not fixing at the mother's face, if they don't follow bright objects, they don't respond when you pass them an object, they don't grab for it, it's actually a sign there's something wrong with the children's eye. So sometimes you see all this because of one condition is leukocoria. Leukocoria is white pupil. White pupil is can be caused by a cataract, 白内障. So you can be born with a cataract. It can also be caused by some orbital tumors. So like retinoblastoma is in child. So the child can actually be born with a tumor. So all this can be missed when they actually check their eyes when they were born. So, but if it's a leukocoria, you can see it's quite clear. One eye is white in the center and the other eye is dark in the center. So this is the first one. Other things are dystrophy. Dystrophy are born with it. So one condition is ocular albinism. This is ocular albinism. So ocular albinism is a lack of pigmentation, not enough pigments. So you can see that the iris, the colored part of the eye that's normally brown, is blue or green in color. So that can also happen. There's a lot of glare. The children will have difficulty seeing, poor vision, and nystagmus, the dancing eye. So, and this one is retinitis pigmentosa. It's also something you are born with. By 40 years old, most of patients with retinitis pigmentosa will go blind. So all this actually means that we should regularly check our eyes to look out for problems. Children can also have watery and sticky eyes. So ophthalmia neonatorum is a conjunctivitis, inflammation of the conjunctiva in a newborn, normally caused by gram-positive bacteria. So we can also have congenital nasolacrimal duct stenosis, which also shows some form of blockage of the nasolacrimal duct. Infantile onset glaucoma, which is glaucoma but in a baby or in a young child. Allergic eye diseases, allergies, and vernal keratoconjunctivitis, which is very closely related to allergies as well. So you can get something like that, and it can be caused by all those things stated above. So then we also have a squinting eye. As mentioned just now in the earlier slides, we actually mentioned, in India, in Africa, in Malaysia, we have a lot of problems with squints, misalignment of the eye, 斜视 or 斗鸡眼, Batu-Pajam lah in Hokkien. So then it can cause amblyopia, which is lazy eye. So it needs to be treated early. So sometimes in children, it's normal within the first 6 months and it will outgrow. But you need to check with the eye doctor. Some eye doctor will say, oh, you need immediate treatment, like you need glasses. Or some eye doctor will say, we just monitor first. So you need to send them for an eye doctor assessment. Basically, we want to maximize the potential of vision or binocular vision and also reduce the risk of amblyopia lah. So treatment goal is to have good vision and straight eyes lah. So with good vision and straight eyes, we can get stereopsis, which is 3D vision. So this is a very good example, a very common type of misalignment of the eye. With the glasses, the control is better. This is outward misalignment, exotropia. So we also have lazy eye. So a lot of people misuse this term. They think that one power, low, one power, high power is lazy eye. Not necessarily. So lazy eye can be called 懒惰眼 or 弱视 lah. So lazy eye is actually when you have the full power, but you cannot see clearly, yes, even with full power, because your nerves are weaker, the development is not full. So if we actually look here, it can be caused by anisometropia, the cause, meaning one eye power, one eye high. So in the high power eye, the vision is not that good. It also can be caused by high refractive error, like if you have a -8 in one eye or in both eyes and you're not corrected, then it can also lead to lazy eye. Can be caused by misalignment of the eye, strabismus. Can also be caused by obstruction of visual axis. A good example will be the childhood cataract that we mentioned just now. So there's an obstruction, something blocking the image from stimulating the visual growth. So this can happen up to 4% of children. And it's normally unilateral, one eye. So normally it's one eye got cataract, one eye no cataract. So the eye with the cataract will see badly, will have lazy eye. So these are lumps around the eye. The first one is a chalazion. So chalazion is actually a blockage of the meibomian gland, which is the oil glands on our eyelid. So the blockage can actually cause an inflammation and infection. It can cause a swelling.
这个是针眼嘛，像长针眼。
长针眼在外面。
哦，这个
This
是
is
从里面。
inside 包在里面。
哦。
So it's a different gland.
嗯
Yeah, but it's also related to the eye tears
明
gland.
白。
Yeah. So this one is acute allergic reaction. So it can be swollen, it can be
上
red.
下左右。
对
Up
对，
and down,
整
left
个
and right.
眼睛都肿起来。So allergy. So you normally need to see the doctor to get oral medication to reduce the swelling. Then this is a hemangioma. This is an example. So this is a malformation from birth.
Okay.
So normally within 7 years, it will slowly subside. If
Oh.
it doesn't go away, the doctor will operate.
Within 7 years.
Yeah, first 7
Since
years of
when
life.
he or she is
Since
born.
born, yeah.
Oh, okay.
So within 7 years, it will subside. If it doesn't subside, the doctor will operate.
But cannot conduct any operation within 7 years.
Depends on the doctor lah,
depend lah.
because sometimes it's blocking the vision. Then you need the surgery quick.
Oh.
But sometimes it's like that, not blocking anything, it's just not tak cantik, not nice, bosui. So then what we do is we just wait and we operate if it doesn't subside on, it doesn't outgrow on its own. So then other abnormalities are what I mentioned just now, the one in Bitot spots,
Okay.
the one we saw in southern India.
Oh.
So this is when there is a vitamin A deficiency.
Okay.
So this is a malnutrition. So in
Oh,
Malaysia,
lack
we are
of
very
nutrition.
well fed, so we don't really have malnutrition. You seldom see Bitot spots in our child.
Oh.
And we also have traumatic corneal abrasion. This one can be caused by fingernails.
Oh, okay.
Yeah, or if they play with pencil, if
Okay.
they poke themselves.
So this one is
So
a
this
lick
is a
or
cut.
cure? Oh, a
A
cut.
cut on
Okay.
the cornea. So this can also happen and is quite common. So children with visual impairment are more likely to develop mental illness. So this is like strabismus, myopia, so short-sightedness, eye misalignments. So they are higher risk of developing mental illness. This is a study. So what happened is that they have actually found that they are more likely to develop depression and anxiety. So and also they have lower quality of life even after correction surgery in strabismus in my eye misalignment case. So it is very important to correct, to rectify the problem young so that it doesn't affect them mentally. And also, so it's to enable them to develop and grow up normally. So then the next one is optometrist. Optometrist role in detecting eye diseases is very important. We have another study. This is from a Canadian study. So this one, they actually talk about ophthalmologists. Referral to ophthalmologists. They talk about pediatricians, optometrists, and general practitioner doctors. So what they actually found is that out of 1,241 patients, there were 49.3% from GPs, general practitioner doctors, 25.2% from pediatricians, children doctors, and 25.2% from optometrists. So, and they found that there is a very high false positive. False positive is a wrong referral, meaning you say, oh, he has strabismus, he has eye misalignment, but go to the doctor, is false positive, it's normal. So the false positive is very high with the GP and pediatrician and much lower by more than half from the optometrist. So the false positive is 38% when referred by the general practitioner doctor and the pediatrician, the children doctor, and it's only 15% when referred by the optometrist. So in a way, we are more accurate in diagnosing and detecting children problems. So then the other thing is they actually say that the diagnostic accuracy, in terms of accuracy, is about 50% for general practitioner doctor and pediatricians. And it's up to 89%, close to 90% from optometrists. So they actually highlighted through this study, it's very important for optometrists to do an eye check on all children because they are more accurate in diagnosing and detecting eye problems, especially in children. so they can decrease the number of false positive. So they decrease the workload of the ophthalmologist to recheck, and also they increase the efficiency of pediatric ophthalmology. So in conclusion, there can be many things that can happen to a children's eye, from a very normal thing like short-sightedness, astigmatism, to very uncommon things like cataract, orbital tumors. So do get your child's eye checked with our focus point optometrist as soon as they start going to school, maybe between 5 to 7 years old. Because if anything is missed, it can lead to conditions like lazy eye and permanent visual loss, and also it may affect their mental health and development. Yeah, that's all from me today. Thank you.
Wow, once
Yeah.
again, very good sharing from Miss
Yeah.
Chia. Of course, any of the friends would like to have any question, yeah, regarding your kids' eyes problem or maybe facing certain problems? Yeah, Miss Chia, I want to ask,
Yeah.
if let's say as a parent, sometimes we observe like the kids might, they wouldn't say they're facing problem, right? Maybe for those kids which very young, much younger, they wouldn't know how to express themselves. But parents realize, oh, if something goes wrong with the eyes. So usually they will be very nervous. It's like, my kids' eyes problem. So the best solution is straight away bring their kids over for professional optometrists to check out, right?
Yeah. The optometrist generally can check the school-going child, but if you realize that there's a problem and the child is not school-going yet, then you may want to send to a pediatric ophthalmologist, which is an ophthalmologist or eye doctor specialized in children.
Pediatric
Ophthalmologist.
ophthalmology. Oh.
Yeah, so if they are like 3 years old, 2 years old,
3 or 2.
maybe below 5 years old,
Okay.
you can send them to a pediatric ophthalmologist. They have drops. They can put the child on drops, and they have special instruments to check the child. Yeah, but if they are school going, they can read ABC, they can respond and understand instruction. You can
Okay.
send them to an optical shop with us, with our focus point optometrist. Yeah. So, but for children, sometimes they don't know how to express. So it's also important for parents to pay attention, like not responding. You know, you pass them things they won't catch, they won't grab.
Not like the
Or
normal
like if you
reaction.
play toys with them, they won't follow the toy, or they don't recognize their mother. You know, they
Oh.
cannot tell which one is the mother, which one is the father.
Wow, very scary.
All those things are signs that there's something wrong with the children's eye or the baby's eye. Yeah, so for parents to be alert, or like they start to copy a lot of wrong things from the board, it's also a sign that there's something wrong with the eye. Yeah.
Oh, which means parents can actually see the minor hints.
Yeah.
Oh,
Should
maybe
catch the
sometimes-
signs early. Should be
Maybe
more,
sometimes
yeah.
kids or children, they wouldn't know how to express. They just like
they don't know, they accept that this is normal for them. They are
Oh.
not aware that actually this is a
Something
problem.
goes wrong maybe.
So the parents will have to pick up the signs on behalf of their children. Yeah.
Nice share. Because sometimes we wouldn't know, right? Until something's already happened already. Oh, I'm very worried about my kid. I'm not sure why. Maybe it's too late already.
Yeah,
Understand.
yeah.
All right,
Okay.
once again, ladies and gentlemen, a very great share from Chia for sharing such details, which is if any of your friends or any of yourself, maybe sometimes your kids facing certain eye problems, which is urgent or not urgent, or maybe you realize like Chia being shared, which is certain hints actually given by your kids or children, please bring them to the...
Focus point optometrist for an
Yes.
eye check.
All right, once again, ladies and gentlemen, greatest thanks to Chia for such great sharing. And of
Thank you,
course, if
thank
any of
you.
the problems or any friends would like to ask more about the details, they can actually check with you, right?
Yeah, I will be here. Thank you very
Yes.
much.
Once again, thanks, Miss
Yes.
Chia.